Welcome, everyone. This is Richard Mollot with the Long-Term Care Community Coalition. Those of you who are watching online can see that I'm actually in a new location today. I am visiting my parents down in Florida in anticipation of the Thanksgiving holiday. So welcome, everyone, for sharing a little bit of this week with you. As I just mentioned before we got started, please post any questions in the Q&A. If you are having any technical issues or wish to comment, you are, of course, welcome to use the comments for that, but we're going to be allotting time at the end of the hour for Q&A. Today's program is on a guide to nursing home oversight and enforcement. I am really excited about today's program. Before I get started, though, just a little housekeeping. In addition to posting, of course, questions and Q&A, comments, as I mentioned before, a little bit about our organization, the Long-Term Care Community Coalition. We are a nonprofit, nonpartisan organization dedicated to improving care and quality of life for elderly and disabled people in nursing homes, assisted living, and other residential care settings. Most of our work is focused on policy research and analysis, including what we're going to be talking about today. And from that research and based upon that research and analysis, our focus of our work, is on systems advocacy. From that work over the years, especially I would say over the past 10 years, we've been doing more public education to help equip residents, families, long-term care ombudsmen, and attorneys and others who work with residents and families on residents' rights, on care requirements to fulfill our mission, which is to improve care and quality of life and dignity for residents in long-term care settings. We're also proud to be the home of 2 local long-term care ombudsman programs here in New York State. Both of them are situated in the Hudson Valley. All of our materials are free and they're available on our website, nursingHome411.org. This program is being recorded and it will be available on our website as well as on our YouTube channel, which is accessible on YouTube, of course, or through our website as well. I'm going to provide a brief background on the nursing home requirements today and the foundation for our research here. And then I'm going to hand it over to our policy attorney, Hayley Cronquist, who will be talking about some of the work that she really led on developing the guide and what the guide means and how it's relevant to nursing home care, nursing home oversight, and our individual as well as systems advocacy to improve care and quality of life for residents. So I always like to start with the nursing home reform law and why it's important. It's a particularly relevant start for today's discussion because we're focused on the rules and how the rules are enforced or supposed to be enforced for nursing home residents. But most importantly, when I think about the nursing home reform law, which passed the federal law, it passed in 1987 during the Reagan administration. It's really a very special law. It requires that every nursing home that takes any money from Medicare and or Medicaid, the Medicaid programs, which is virtually every nursing home, not every single nursing home, but virtually every nursing home in the United States. It says that they agree to meet or exceed all of the standards that are laid out in the reform law, as well as in its implementing regulations, what are called the requirements for participation in Medicare and Medicaid. It's important to note, especially from a consumer perspective, that participation in Medicare or Medicaid, taking any amount of money from one or both of those programs, is entirely voluntary. So if a nursing home does not want to meet the standards in the reform law, does not want to meet the federal requirements, they can run a private facility. But the vast majority of nursing homes, as I've mentioned a couple of times now, participate. They take some money from Medicaid or Medicare, and they are essentially relying on us, relying on the public to fund their profits, to fund their programs, et cetera. And in doing so, again, I just can't emphasize enough, and I always reemphasize for myself, even though I've been doing this for almost 2 decades now, how important that is, because they don't have to be part of Medicare or Medicaid, but if they're going to do that, they owe it to us as taxpayers, and certainly they owe it to residents and families to be providing good care in accordance with these standards. So what are those standards? The federal law requires that every single nursing home resident is provided the care and the quality of life services that he or she needs to attain and maintain their highest practicable physical, emotional, and psychosocial well-being. Practicable can be a bit of a mouthful, so I think it's important to distinguish. It's not highest practical, it's highest practicable. And practical would mean, oh, this is what is, what we want to do as a nursing home company or a nursing home operator, based upon how much we want to pay our administrator, how much we want to spend on food, how much we want to spend on resident care, how much we want to make in profits. What's left over is what's practical for us to be providing care for residents. What the law requires, contrary to that, is practicable. And this is where, as I think I mentioned before, I think the law is really special. It focuses on the resident. And when a facility accepts a resident into their facility, they are saying that they could ensure they have the staffing, they have the ability to provide services to ensure that that resident is able to achieve what is practicable for that individual, not only physically, not only clinically, but also their emotional and psychosocial well-being. So that means, for instance, that if I go into a facility and I have the ability, or generally have the ability to walk, or have the potential to walk, I should not be put in a diaper because there's not enough staff to help me walk to the bathroom. If I don't have pressure ulcers, I should not develop pressure ulcers because there's not enough staff around to help me get up, to help me be repositioned, to be providing the monitoring that I need to ensure that I don't develop pressure ulcers. If I am generally an interested person in say, what is going on in the world, I may be interested in my church or my temple or my mosque, I should be able to keep up those interests. Maybe not driven to a church or a temple or a mosque every day. That's not necessarily required, but ensuring that I'm getting those services and those services are coming to me, or I'm being helped connect to them, so that I'm able to maintain my well-being as an individual. And again, all of these different components that are important to us all as individuals. So as I've said a number of times, I just want to mention again, which is the next bullet, the law really emphasizes individualized resident-centered care. And importantly, it lays out a lot of residents' rights in regard to monitoring, in regard of a resident, in regard to good care, and ensuring that every resident has the maximum amount of choice, is living with dignity, and has as much autonomy as possible. Now, when we live in a nursing home, of course, that is a congregate setting. So we have to be respectful of one another and others people's choices and their autonomy as well. But what the rules say over and over again, and what the guidelines from the feds say over and over again, is that it's the responsibility of the facility, it's the responsibility of everyone that the facility hires, everyone that is providing any amount of care or services to the resident, that individual is meeting the resident where he or she is. It's not supposed to be a top-down environment. It's supposed to be a foundation emanating from the resident and those who are providing care to them. So the question, this really gets at what we're going to be talking about today. If the laws and the standards are so strong and really do speak to all these different aspects of an individual's well-being, why are so many nursing homes, frankly, crummy places to live and get care? And the answer for that is that the law and the standards can only make a difference in the lives of residents if they are enforced. The laws are not self-implementing. Just having them on the books doesn't mean they happen in the lives of residents. It takes adequate and effective monitoring and enforcement and response to issues and problems that occur in nursing homes to make sure that those issues are resolved and that residents have good quality of life and good care. So we've done a number of studies on this over the years. As you can see from this slide, there's been reports from Forbes to the New York Times, to US News and World Reports and USA Today, many local papers across the country, unfortunately, a day in and day out, as well as federal reports. We have a couple of covers here from Government Accountability Office and from the Office of Inspector General, report after report, finding that these baseline tenets that we talk about are largely unrealized in the lives of nursing home residents. I'm just going to talk about a couple of them. In 2015, we actually did a study that looked at federal data for a 3-year period. And we found that from 2014, I think it was, to 2012 to 2014, 12, 13, and 14, 3 years, we found that there was a significant failure on the part of the state agencies responsible for overseeing nursing home care. It's usually the Department of Health or the Department of Public Health, the state agency, that they failed to identify resident harm. So we have really a twofold issue here. One is that too often poor care is not adequately identified. Substandard care, resident abuse and neglect are not identified by the state agency. But what's important here, what we're getting at here, is not only is there there's an under-identification, excuse me, of substandard care, but also even when the state agency does identify substandard care or neglect, they rarely identify it as causing harm or immediate jeopardy to residents. And that's really important because unless the surveyor, the inspector, has identified and substantiated that there's been harm or harm to a resident, or a resident has been put in immediate jeopardy of harm, it's very rare that there'll be any penalty. So the message that the industry gets even when there is a citation, it's very rare that it'll face a penalty. So it knows it'll be paid. The operator knows they'll be paid for that level of substandard care, and they won't face a penalty. Message being that they can continue operating at that low level. That study that we did in 2015, which looked at every single state, and it's still on our website, we noticed as researchers that there seemed to be differences regionally across the United States. So just a little bit of a brief background is that the state agencies, as I said, they're responsible for overseeing nursing home care and ensuring that residents are protected. They in turn are overseen by the Federal Centers for Medicare and Medicaid Services, which develops the rules for nursing homes and which is ultimately responsible for ensuring that those rules are enforced and realized in the lives of residents. Those CMS, operates and oversees the states through 10 regional offices across the country. And we found that there seemed to be some differences that weren't just on the state level, they were on the national level as well. So we did a project this past year with funding from the New York Community Trust to look at what is going on. Let's refresh and expand on that 2015 study. Now that we've seen, of course, the tragic impact that COVID-19 and the pandemic had on nursing home residents. Now that we, I think, have a better sense through regulations that came out in 2016, through survey guidance that came out in 2019, of what should be going on here and what kind of oversight should be going on here. Let's see again what is going on in the lives of residents. To what extent are these rules being enforced by the states? And also, to what extent are the CMS regional offices making sure that the states are doing their job to protect residents? So that resulted in the guide that we're going to be talking about today to nursing home oversight and enforcement. As Hayley will talk about, what we did is we went through all the requirements for the state oversight agencies, the state departments of health, and we put it together in a guide that is really user-friendly, that residents and families, ombudsmen, those working with them, and policymakers can use and look to see what is supposed to be going on here. Where does the buck stop? And if it's not stopping with the state oversight agencies and CMS, what is going on and why? And then the second thing that we did with this project is, as I said, we did the assessment, And that resulted in our report called Broken Promises, an assessment of nursing home oversight and the impact of lax enforcement on residents and families. That actually wasn't the initial title of that report, but when I was reading it over as we were editing it, I said, you know what we're really talking about here is unfortunately broken promises. Eric Goldwine, our Director of Policy and Communications, will be presenting on our findings there in our next webinar in December. So without further ado, I am going to hand it over to Hayley Cronquist, our policy attorney, who will take you through the rest of the program.
Thank you, Richard, and thanks to everyone for joining us today. So as Richard just mentioned, this is really a two-part webinar series, with today's webinar being about the expectation of state agencies charged with ensuring resident safety. And then in December, Eric will discuss the reality of nursing home oversight and enforcement. But today I'm going to discuss what we can expect from state agencies in terms of their role in nursing home certification, surveys, enforcement, and more. Next slide, please. So again, what we did for this project is a little bit repetitive from what Richard just said, but what we did is we reviewed the state operations manual and we pulled out sections and pieces that we thought were important to residents, family members, advocates, and others to know to help support their resident-centered advocacy. And while the report is still a pretty hefty document at 86 pages, I can promise you it is much shorter than the full state operations manual, and hopefully we believe much easier to use. Next slide, please. So I'm just going to briefly reiterate a bit of the background here, because it's just really important to understand that, as Richard mentioned before, nursing homes are required to meet certain minimum standards laid out in the federal nursing home reform law that passed in 1987 in order to receive Medicare and Medicaid money. So the federal agency, the Centers for Medicare and Medicaid Services, known as CMS, they contract with state agencies, which are often state departments of health, to ensure that every nursing home certified under Medicare and or Medicaid meets or exceeds federal standards of care for all of its residents. And these state agencies are the principal agencies responsible for overseeing nursing homes and responding effectively to complaints about care. So they are responsible for inspecting facilities, recommending enforcement remedies, responding to complaints about care, and much more. Next slide, please. Thanks. So what is this document that we spent so much time reviewing? The State Operations Manual, or the SOM, as I may call it throughout this presentation, is a federal document issued by CMS, and it contains the survey and certification rules and guidance for nursing home surveyors to assess whether or not facilities are complying with the regulatory requirements. So the SOM is 10 chapters long. It is more than 1,000 pages, and it covers a range of topics, including nursing homes, hospitals, laboratories, home health, and more. So we focused our review on the sections that are relevant to nursing homes. And while Chapter 7 is the main chapter that focuses on the survey and enforcement process for nursing homes, there are relevant sections in other chapters kind of scattered throughout, which is what I think makes this guide so useful, because otherwise you're doing a lot of digging, and like I did when I first got started, getting mixed up with other health systems, and it can just be really overwhelming. But just an introduction to Chapter 7, it starts with 3 expectations of nursing homes and oversight agencies. So the first expectation is that providers remain in compliance with the Medicare and Medicaid program requirements, as well as state law. The second expectation is that all deficiencies are promptly addressed. And the third expectation is that residents receive the care and services they need to meet their highest practicable level of functioning. Next slide, please. So our guide covers really important guidance on the following 6 categories, and I'm just going to go into a little bit more detail on each of them. So the first one is program background and responsibilities. This section explains the basic role of certification. It covers the foundation for state agency activities, the function and responsibilities of state agencies, and the role of CMS in the process. So certification is when the state agency officially recommends its findings on whether a nursing home is complying with the standards required by the federal regulations. And this certification process includes investigations, fact-finding surveys, explaining requirements and providing educational programs for staff and residents, data entry, and more. So just a little bit on CMS's role in this. CMS, like Richard said, is responsible for evaluating the performance of state agencies. They're responsible for providing assistance, allocating funds, and providing feedback to states. And so, they're really responsible for overseeing the states to make sure that the states are, doing their duty to oversee nursing home care. And this section is also where you can find information about approval and correction of deficiencies, along with an example of a statement of deficiencies, which I'll show you later in this presentation. The survey process, number 2. This category is really the core how-to for nursing home surveys. It is a really important section, I believe, for residents and family members. Surveyors are, they're required to follow certain protocols and guidelines to determine the appropriateness of a citation. And this section discusses those protocols and hopefully gives you a good idea of what you can expect from a nursing home survey. You'll also learn about pre-survey preparation, the survey team size, team composition, and the survey length, which those are all really dependent on the size of the facility, the needs of the residents, etc. And that's discussed within the section as well. You'll also learn about conflicts of interest for surveyors. So for example, if a surveyor has a financial interest in the facility or an immediate family member living in the facility, they won't be able to survey that specific facility. That will preclude them from doing so. And then this category also contains information about the complaint and incident process, which is found in Chapter 5 of the State Operations Manual. The investigation and resolution of complaints are critical certification activities and requires that state agencies promptly review complaints and incidents, conduct unannounced on-site investigations so that nursing homes don't know when they're coming in, and informing CMS of the findings. And with that, there are guidelines for how state agencies should respond to complaints and incidents based on the severity of the problem. So, if it's an immediate jeopardy situation, that's obviously where they need to put their sites first. The third category is state oversight performance standards. So this category covers the requirements which state agencies must meet in respect to their responsibility for ensuring that nursing homes provide care in compliance with the federal standards. So there are many performance standards required in the Section 1864 agreement, and that is the contract between CMS and states for the state agencies to carry out these duties. In this section, you will learn the different things that constitute inadequate survey performance. So when a state demonstrates a pattern of failure to identify deficiencies, a failure to properly input data, a failure to identify an immediate jeopardy situation, and more. And it also covers CMS's evaluation process for ensuring that state agencies are properly carrying out their duties and conducting oversight. And if not, then what CMS can do to ensure that going forward, they are doing their job. And that can include training, sanctions, or even terminating the agreement if it's bad enough. The fourth category is enforcement and remedies. So this section covers the enforcement actions and remedies by state agencies and CMS when facilities are found to be out of compliance with federal requirements. So you will learn all the different types of federal remedies that CMS can take action on. And that includes terminating the provider agreement, so not allowing them to receive any more money, instituting temporary management, state monitoring, transferring residents, and others. And you'll also learn the actions that must be taken in immediate jeopardy situations and requirements for reporting abuse and neglect. The fifth section here is civil money penalties, CMPs. So civil money penalties, or CMPs, are one of the remedies imposed by the regulatory agencies that license nursing homes if a nursing home does not comply with regulatory standards. And then these fines can then be used to fund innovative programs to improve the lives of nursing home residents, among other things. So this category covers the basis for CMPs, how the amounts are determined, when they are due and payable, and how CMPs are collected and used. And also at the end of this section, which I'll show you guys later on our website, there is a link to a national study on the use of CMPs to protect nursing home residents, which I think you would find really interesting and useful. And then the last section, or the last category, I'm sorry, is information disclosure. So this last category discusses the survey and certification information that must be disclosed to the public. So what and when information must be available to the public, and that can include the statement of deficiencies and plans of correction, facility comments, notices of provider terminations, and more. And information that also must be provided to long-term care ombudsman, which again includes the statement of deficiencies, reports of adverse actions imposed on a facility, a facility's request for appeal and the results of any appeal, and more. So you'll also learn in this section the information that must be furnished by facilities to a state agency after a facility has received a notice of substandard quality of care. And this includes each resident in the facility that was found to have received substandard quality of care and the name and address of that person's attending physician. Next slide, please. So this is just an excerpt from the guide. This is from the survey process section. And this includes, like I mentioned before, the requirements for survey team size and composition, which again, really depends on the size and the need of the facility. The survey frequency, which is every 15 months for a standard survey. Conflicts of interest, the complaint incident process, and how state agencies manage those complaints, and all of the different types of surveys and how they are conducted. Next slide, please. So why do nursing home surveys matter? I said this before, but it is worth repeating. Nursing home surveys are the principal mechanism through which nursing home quality is assessed and compliance with standards is determined. If we as advocates and family members and residents and researchers and whoever else know what to expect from these state survey agencies, it's just another piece of information that we can use to advocate for good quality of care for residents and loved ones. And along with the protocols and guidance, CMS provides nursing home surveyors with this system to help them identify relevant criteria for evaluating whether a nursing home is meeting all of the appropriate standards. So based on the law and regulations, this system is comprised of F tags, F meaning federal, and guidance to help the surveyors understand the requirements and how to evaluate for compliance with them. And F tags are then cited in the statement of deficiencies, which I'll show a sample of. And then the scope and severity grid, which I'll also show, is used by CMS and state agencies for rating the seriousness of a deficiency. And then just an important note here, numerous studies by different agencies and organizations have found that surveyors often fail to identify nursing home problems adequately, including serious care problems, which I will provide an example of shortly. Next slide, please. So as I mentioned before, CMS provides the system for surveyors to identify and rate the deficiencies. So this is the scope and severity grid. This is what helps surveyors rate the seriousness. So the surveyor indicates the level of harm to the resident, which you can see on the left side of the grid. It ranges from no harm to immediate jeopardy. And then the scope of the problem within the facility, which is on the top of the grid. So whether it was an isolated incident, a pattern, or a widespread problem. And again, unfortunately, more than 95% of the violations identified are cited as causing no harm to residents, when in fact, in many situations, and you will see why, we believe it should have been cited as causing harm. Next slide, please. So this is an example of a statement of deficiencies and plan of correction. It is also known as Form CMS 2567. So this is essentially the written record of a surveyor's findings of a facility's failure to comply with one or more standard. And you can find you can find deficiencies for facilities on the Federal Care Compare website, which I will show you after we are done with this slideshow. So I actually took this statement of deficiencies example from our latest Elder Justice newsletter, which, if you are not familiar, is a bi-monthly newsletter where we highlight randomly chosen deficiencies from all across the US that have been cited as no harm that, again, we believe should have been cited as harm. And you will see why when I'm done with this explanation. So on the left-hand side there, you can see the F tag, which I mentioned is the system through which the federal regulations are identified in the survey process. So this deficiency specifically is for F760, and that falls under the pharmacy services category of the Code of Federal Regulations. It's CFR 483.45, which is just a lot of information to remember, and it's not really necessary. But it is specifically for residents' right to live free of significant medication errors. So in this deficiency, the surveyor stated that the facility neglected to provide the resident with the proper medication as prescribed. So in this situation, a resident was admitted to the nursing home with hospital orders for an anticonvulsant medication for seizures. But after missing 3 doses of the medication that was prescribed by the doctor, the resident was found with blood coming out of his mouth. The resident's teeth were clenched, and the facility staff were unable to open the resident's mouth. So after giving the resident an anti-anxiety medication, the staff were able to open the resident's mouth and found that he had bitten off part of his tongue. In an interview, the director of nursing stated that the resident wasn't given his medication because it was unavailable from the pharmacy. So despite the medication error leading to the resident seizing and biting off part of his tongue, the surveyor cited it as no harm. And while this may seem like a particularly egregious situation, check out our newsletter. The deficiencies that we find that have been cited as no harm are extremely alarming. And so if you are interested in learning more about these, I highly recommend signing up for LTCCC alerts so that you will receive these newsletters in your email, and you can also find them on our website, which I will show you. Actually, I'm going to ask Richard to stop sharing, and I will do a little screen share myself so we can look at those. Okay. Just need to pull it up here. Sorry, bear with me. Okay, so again, this is actually, this is the Care Compare website. So this is where I mentioned is where you can find the deficiencies for different facilities all across the US. So I've just put in my zip code here. You can put in the provider type. I've chosen nursing homes, and I'm not going to put in a name. I'll just do a random search. And this will pull up all of the facilities within my search distance of 25 miles. So we'll just go with the first one here, Cobble Hill Health Center, just down the road. And once you pull this up, you can scroll down and it says health inspections right here. And then you can view the health inspections, and it gives you the date of the most recent one. And then if you view the full report, it shows up like this. And this is the statement of deficiencies that I showed an example of. Okay, I just need to pull this down a little bit. Okay, so now I'm going to take you to our website, LTCCC. It's nursingHome411.org if you are not familiar, but hopefully you are. Hopefully you're regulars here. So this is our website, and I'm just going to show you where you can find the Elder Justice newsletter. So if you go here on our top page, you go to News and Reports and scroll down to Elder Justice newsletter. And this is the one, he bit off part of his tongue. So this is the example that I pulled from in my presentation. So I'm just going to click on this, and it provides just a little bit of background on what is included in the in this specific newsletter. And so you can see the different types of deficiencies that we cited. And then if you pull it up, you can actually download it. And I'll just pull it up here. So in this issue, we covered deficiencies in New York, Indiana, Oklahoma, South Carolina, Maine, and Utah. And we really try and cover different states every time, just so that we can really give a broad perspective so that people understand that this is, really a nationwide problem. So I'm just going to click on the Auburn Village one in Indiana, because that's the one that I've already discussed before. So this provides, the background of the citation, and then it gives information about the citation based on the surveyor's findings. And then you can also click the SOD here, which is Statement of Deficiencies. And this will take you right to the deficiency if you'd like to read more information, because obviously we can't include every detail about it. So that is the nursing home 411 Elder Justice newsletters. Now I'm going to take you back to our website and take you back to the guide. So I want you to be able to find it really easily. It's pretty easy. So you can first find it by typing in nursinghome411.org/survey-enforcement. That's one way to find it. But then you can also come back to news and reports, go to LTCCC reports, and it's actually the first one right now. So if you click on that, this is the alert for the report. So this will give you just a little bit of background on the project and why we did this. And then the first link here is actually a link to the broken promises. It'll take you to the main page of both reports. And so this again just provides a little bit of background on the nursing home reform law, and then it provides links to the expectation, which is the guide, and then the reality, the broken promises report that Eric will discuss in our December webinar. So I'm going to take you to the guide. Okay, so as I mentioned before, it is broken up into sections to hopefully make it as user-friendly as possible. If you want, you can download the full report. It'll open in a new tab and takes a minute to load because again, it's very long, but I hope that it is useful. And you can just slide through this. There's a really great table of contents, so you can jump to, if you're interested in learning the program background responsibilities, you can jump right to it. So it's really user-friendly. But I'm going to take you through just briefly, since I already kind of discussed these pretty in depth, but the first section here is the introduction. And this just provides a background on the guide, it goes over the nursing home reform law and what the state operations manual is. And then each section, it gives a little bit of a background on what is included in the section, and then read more. So if you click on this, it will open to just this section of the report. So again, like I said, you can download the full one and read it all the way through. But if you're interested in just a very specific section, such as the survey process, it tells you what you'll learn in this section. And then if you click read more, it'll open up and show you the whole survey process section of the report. And so there are these, main headers, there's notes throughout, there's subheadings with different things that are included in the guide. So the team size, team composition. And then I just want to point out really quickly that this SOM section 7201.1. So SOM obviously is the state operations manual, as I said. And then it's section 7201.1. So that tells you that it's in chapter 7, which is the main survey and enforcement part for nursing homes. So that'll just give you a little bit of background there. I'm just going to go back. So we have each section: the program background responsibilities, survey process, the state oversight performance standards, the enforcement and remedies for nursing homes, the civil money penalties, and the information disclosure. Lastly, we have the appendices, and I'm just going to open these up just so you can see what's in here. So the first one is the F-tags list. So this is what I was telling you before, is the F-tags that fall under the federal regulations categories. So you can just see what the different F-tags are, if it's hopefully that it's helpful for you. And then if you scroll down, Appendix 2 is the scope and severity grid, which again, I already showed you and discussed. Appendix 3. So this is the CMS summary of certification and compliance for nursing homes. So this was actually just taken straight from the CMS website, and it just provides information that we've kind of provided today, but on the background of the Medicare and Medicaid program and how states can participate, or how facilities can participate in those programs. Appendix 4, this is just terms and acronyms used in the state operations manual as well as in our guide. So this is, I think, a pretty helpful part of the appendix. And then Appendix 5 is the national and general resources. So this is really just any resource that you can think of. You know, hopefully we've provided, we really provide a lot of resources on our website, but there's so many more. So there's CMS, the Long-Term Care Ombudsman Program, which if you aren't familiar with one in your state, you should. All different ones. Care Compare, which is what I showed you earlier, where you can find deficiencies. And this was actually previously Nursing Home Compare. It was actually Nursing Home Compare, I think, when I first started with LTCCC a little over a year ago. So it's pretty recently changed to Care Compare, but just so you know that. And then 6 is the federal definition of substandard quality of care. So this is really important because I know I discussed earlier that, you know, facilities are required to provide certain information if there's found to be substandard quality of care. So it's important to just understand that definition. This is the Aspen Complaints Incident Tracking System. So this is how the complaints and incidents are. It's just data input, basically. Nothing that you would use if you're not a surveyor, but it's important to understand. And then lastly is just a chart on the revisit date of compliance policy. And I think that that's, I mean, it's a little bit hard to use, but again, there's more information in our guide. So hopefully that will be helpful for you. And then that, I guess, is pretty much it for the guide. And I know that it's a lot of information, but I hope that we narrowed it down and organized it in a way that is helpful to all, including, you know, residents, families, researchers, advocates, really everyone. And I just want to lastly say that, you know, a state's oversight of nursing homes, it boils down to 2 components. First is its ability to identify when a failure to meet standards exists. That's the deficiency. And then secondly is its ability to appropriately rate the deficiencies it identifies in terms of its scope and severity. And again, like Richard said, and I'm pretty sure like I said earlier, despite the law and regulatory standards that have been in place for over 30 years, serious nursing home problems they persist. And I'm sure you all know are widespread. I hope I made that clear with the examples from the EJN. It's really across the country. And this is because, again, care standards can only make a difference in the lives of nursing home residents if they are enforced by the state and federal agencies responsible for nursing home oversight. And so on that note, I will conclude, but you will need to sign up for our December webinar to learn about the reality of nursing home oversight and enforcement and the data that supports those findings. And so Eric is really going to go in depth on our data report, and I hope that that is useful for you. And I am just going to go back to our slides here. So here is the December webinar. Again, Eric will put a link in the chat so you can register for this. It's on December 21st at 1 p.m. and we hope to see you there. And I'll hand it back to you, Richard.
Thanks, Hayley. That was excellent. I hope that it was helpful to everyone who joined us. Again, the program and the slides will be available on our website, and the program itself will be available on our YouTube channel as a recording in the next couple of days as soon as it's processed here. But I hope that this has been useful, and I really believe that the guide will be useful for all of us into the future to get a better understanding of how we make the expectations and requirements for nursing home care and nursing home quality of life, how we make them a reality in the lives of residents. So we do have a few questions, and I'm going to read them, and then Hayley and I will hope to be able to answer them. The first question is from, I hope I'm pronouncing your name correctly, Ko Fung. And its question is, what are the roles of the mayor's office and city council on the state oversight nursing home operations? And I can answer that. There's actually no role for the mayor's office or the city council or any other municipality, including counties, when it comes to state oversight. The quality of care in nursing homes and oversight of that quality of care is pretty much totally a federal and state shared responsibility, as Hayley was talking about today. As I mentioned earlier, fundamentally the requirements for quality of care go to CMS, the Federal Centers for Medicare and Medicaid Services, and they contract with the states, and the states are required to carrying out oversight of nursing homes in their individual states using all of the tools and all of the guidelines that Hayley has been talking about and which we are providing in the guide. So thanks for that question. The next question is Patricia Kinzer, excuse me. Has there been an audit at any level of government of the distribution use of the 3 economic impact payments to which all nursing residents were entitled? This is unfortunately not really related to what we're doing, and it's not an area in which I could respond. I don't think, Hayley, I don't imagine you have any other insights into that. Sorry about that. Michelle Dorota, thank you for an excellent presentation. Thank you, Michelle. If surveys are unannounced, how are family members able to participate in the immediate feedback process through interviews or comments with surveyors, especially during the pandemic? So Hayley, if you have any thoughts of that, and then I can add too.
Yeah, that's an interesting question. They are unannounced to the facility, but again, they're not usually just a one-day thing. And so once a surveyor is in the facility, hopefully, the resident is able to let, family members know so that family members can participate. But again, obviously during the pandemic, they actually stopped standard surveys and they focused on infection control, which was obviously extremely unfortunate. And I know that CMS actually just recently announced that they're going to start looking into the backlog of surveys. But again, that's, it's been over a year of missing out on these surveys. So I think that's going to be a very long process.
Thanks, Hayley. That's a great answer. I would just add that, the surveys are supposed to be a surprise. However, when the survey team arrives, and as Hayley said, it's generally several days, usually close to a week that they're there, the Ombudsman program is alerted immediately to the start of the survey. So they don't get advance notice, but they are told when they're supposed to be told by the state agency when that survey is taking place. So we always encourage family councils and ombudsmen to connect with one another. And we have some resources and tools on our website to help foster that. But, you don't need to use those resources or tools. You can do it on your own. There is, if you just look up LTC Ombudsman, or if you're in a facility, there are posters for how to connect with your ombudsman. You can, I think introducing yourselves to them as family members and vice versa, if you have not already done that, can help you to be informed about when that's going on. But as Hayley said, not being in the building for the past year and a half now makes it very difficult for that connection to take place. Thanks, Hayley. Thanks, Michelle. Next question is from Natalie Pitikoff. Do you work with Casper data a lot? Actually, we don't work with Casper data at all. We work with, most of the data that we work with is available to the public, and we translate that, we crunch it to make it easier for the public to use. We have a lot of data, of course, on Oversight, which Eric will be talking about, next month. But we also, we get data from CMS, from CMS's website, on the staffing, on antipsychotic drugging through Freedom of Information Act requests, et cetera. But for the most part, the data that we use is available to the public. Carrie Leljadal, I'm sorry if I'm not butchering your name, Carrie, which I should know. The question is, what are we to do when we have filed multiple complaints against the facility and they are never being cited. And that's really the heart of why we did this research. So I think with what Hayley spoke about today and with the tools that she took everyone through, one of the purposes of that is to help you and help others see what the expectation is of the state agency in terms of responding to complaints and be able to use that to act further. So we have on our website I think an abuse and neglect reporting page, and there is contact information for the CMS regional offices there. So you can certainly contact the regional offices or the central office. And then we also strongly suggest that you contact your local legislators, both state legislators and federal, members of Congress or US senators, and let them know if you are not getting an adequate response from your state agency or even from the nursing home. The nursing home is not responding and it's a serious issue. They will often respond to our political leaders, and we really need to leverage that more. I know, Hayley, I'm sorry, I answered that question without asking you first.
Nope, that was great. Thank you.
Yeah. Thanks. Our next question is from Dennis Short. Can you talk about the interaction among state and federal oversight inspection as it plays out on the ground? Hayley, do you want to take that or me too?
You can go ahead, Richard.
Okay, so this is something actually that we have researched and tracked over the years. So as I mentioned a couple of times, and as Hayley was talking about, this is fundamentally the responsibility is fundamentally given to the state agencies, the state departments of health or Department of Public Health, to be ensuring that resident care is good and in compliance with the requirements, both for clinical care as well as providing an environment that is respectful and which resident can live with dignity, et cetera. So the way that plays out is that the regional offices, which are now called locations, those 10 regions across the country, they are responsible for overseeing the quality of oversight that the states are doing. So I think of it as kind of a different levels or different, almost like dominoes together. You have the nursing home responsible for the quality of care, and they have to meet those rules. Too often, of course, we know they don't. So who's supposed to be watching them? The state's supposed to be watching them to make sure that they're doing it. They're supposed to be responding to complaints. As Carrie mentioned, they don't always do a good way. And as our studies show as well, they don't do a very good job too often in responding to resident complaints. And on top of them, responding to that is the CMS regional offices and then CMS central office, which is located in Baltimore as well as a DC office. So they are supposed to be monitoring that. They're supposed to be monitoring what is going on with the states. The tools that Hayley worked on and which she put together from, again, thousands of pages of the state operations manual distilled into the 85 or so page document, you can use that to see what is going on, what the expectations are, and to leverage that information to improve it. The way, and to get to kind of a more practical way of how that works is that the regional office is supposed to be doing what's called look behind surveys. So in addition to general oversight of what's going on in the states, tracking of data of how they're responding to complaints, what is going on in terms of quality and oversight in those states, they are supposed to do look behinds. I think it's roughly 5% of the time. So for every 100 inspections that a state Department of Health does, there should be 5 what are called look behind surveys from the federal, the local, regional office of CMS. So what they generally do is they come in a few weeks later after that first survey has taken place, and they'll do their own survey with federal surveyors / inspectors. And there was a GAO report, and we did a similar study about 10 or 15 years ago now. They came out, I think, roughly the same time, that found, I think it was a GAO that found that federal surveyors find 4 times as many problems as the states do. And again, I don't want to take up too much, we have a couple more questions, but you would think that the state came in, if the state had done a good job and said, okay, these are the problems we've identified. If you want to stay in the nursing home business, with us, you need to correct these problems immediately, that when the feds came in a couple of weeks later, that everything would be perfect in that nursing home. Instead, what the feds found was that 4 times as many problems. So the states would, well, 2 things. One is that the facilities clearly aren't getting their act together too often after the state inspections, but also that the states are missing an awful lot. So that's kind of how the interaction takes place. And it's something that we have been advocating for. And one reason why we did this project, the two aspects of which, one, this, which we talked about today, the other one, which we'll talk about next month, will hopefully inform public policy, inform policymakers, but importantly, inform residents, families, advocates, ombudsmen as to what is going on and what you can do, how you can leverage this knowledge to make things better for residents. And then Kofung asks a question again, who is the key contact if we want to make arrangement for your organization to present this or similar topics? Excuse me. Well, thank you. You can email Sarah at ltccc.org. That's SARA@ltccc.org. And thank you for that. S. Lewis asks, cities, counties have ombudsman programs family members can contact for reporting information. Yes, so what S. Lewis is saying is, again, contact your ombudsman program who can help you with navigating some of these issues, especially if you're having a problem and it's not being resolved. We have a few more questions, several from an anonymous, or maybe more than one anonymous attendee. Sorry if you covered, but can you speak to the unannounced aspect? It's my understanding that many states operate on schedule and that survey is often not a surprise to the facility. Hayley, do you want to respond to that?
Yeah, so essentially how it's supposed to work, and as Richard mentioned earlier, it quite often does not, but how it's supposed to work is that a standard survey is supposed to be scheduled every 15 months, and it's supposed to be done within that 15 months. Again, it is supposed to be unannounced. Often that doesn't happen for whatever reason, but that is how it's supposed to happen. And then outside of these standard surveys, there are also specific complaint surveys. So if there's been a complaint from within the facility, the surveyors are to then go in and assess the complaint, rate, figure out essentially what's going on and how it can be corrected. And those are also supposed to be unannounced. But again, obviously, if there's been a complaint made, that they kind of have an idea that someone will be coming in. So again, it is, I know that there are very specific scheduling details that are included for state agencies. It's included in the guidelines and the protocols for how these are supposed to be scheduled. But again, it's just supposed to be every 15 months, not, on January 1st, every 15 months, or obviously that's, doesn't work, but you understand what I'm saying. It is supposed to be every 15 months, but again, unannounced, so that it's a surprise to the facility, so they can't, wipe the place clean or whatever.
Yeah, thanks, Hayley. And just to kind of piggyback, so it's an annual, the inspections have to take place. This is part of what's in the guide, I believe, but the inspections have to take place overall for the state agency on an average of every 12 months. And they have that 9 to 15 month window for a particular, so they can go more often to facilities where there are more problems within that window, but they also are supposed to be mixing it up in terms of time of day of the week, and of course, within that 5 or so month window. So just going to move on because we have a couple more questions I'd like to catch at least briefly. Can you speak to the identification of deficiency aspect? What do you think the primary barriers are to state surveyors what do you think the primary barriers are to state surveyors actually identifying problems? Hayley, do you want to speak to that?
Well, I'll just say really quickly, again, just to the unannounced surveys, when facilities are warned that a survey is about to happen, obviously, I think that they're able to, I don't really know how to best say this, wipe the place clean. So I think that's probably one barrier, but yeah, Richard, if you want to.
Sure, I would just say quickly, because I want to quickly get to the last two more questions I could see here. And I'm sorry we're not able to get to everyone's questions. because we're at 2 o'clock. But a lot of it is political. The nursing home industry has very highly paid lobbyists in Washington, D.C. and in every state capital, of which I'm aware. And they speak to our legislators. They try to convince our legislators, both in the state and federal level, that they are that it's their interests that are important to protect rather than the interests of nursing home residents. And that's why our voices really are so important. I think a lot of it is just the political pressure that is put on the survey offices and the surveyors themselves too often. I'm gonna just answer quickly 2 questions so we can at least get to them. Can nursing homes hide grievances so the surveyor is not aware? I mean, anyone, of course, can do something inappropriate or illegal or against the rules. However, they are not supposed to, and those records are available for the surveyors to review. And importantly, we've talked about this in other programs, the grievance process, the fact that every nursing home has to have a grievance officer as of the 2016 federal nursing home rules, that is something that we fought for really hard, we and other advocates. And it's really important that people ask who the grievance officer is and that they know, and that the ombudsman and families know that they can request a response from the grievance officer in writing when they have a grievance that they present to that grievance officer. So again, every nursing home has to have a grievance officer, and the complainant, whoever they are, can get a response from the grievance officer in writing. That is their right under the federal rules. So it makes it a little bit harder for nursing homes to hide that if that's the case. And then lastly, and I'm sorry I'm not going to get all the questions, someone asked how much do the activity reports that we as ombuds people submit factor into the surveys? They don't factor at all into the surveys. However, as I mentioned before, the ombudsman program, the local program or the state program is notified when this are supposed to be notified when the survey team goes in, and the survey team is supposed to be talking to the ombudsman and listening to the ombudsman. So if the ombudsman is there, it's why those activity reports, I know people don't like them, that they're so important that the ombudsman have a good record of what is going on, if they're working through volunteers or through professional staff. So with that, again, please join us on December 21st for our program. If you are an LTC ombudsman, you're welcome to take a quick SurveyMonkey questionnaire, just a few questions. And if your program supervisor allows us to provide credit for attending this training program, you can get credit. We will notify them of your attendance. It's surveymonkey.com/r/LTCCC-LTCOP1. And that's it. Thank you so much for joining us. We wish everyone a happy Thanksgiving. Thank you for all of your advocacy and all of your support. And we'll see you soon. Bye-bye now.